Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Amy Bender. She's Information Manager at Tampa General Hospital. And Richard Cruz, he's Inpatient Informatics Analyst II at Tampa General Hospital. Welcome, guys.
Thank you.
Appreciate you guys joining us to talk about some really exciting stuff about, I'd say the hospital room of the future is the theme. But before we go there, maybe Amy, you could start us off. Tell us about yourself in Tampa General Hospital.
Sure. Tampa General Hospital is a academic medical center. We're about 1,000 beds, maybe a little over 1,000 beds. Primary teaching hospital for the USF College of Medicine.
Okay.
So our mission is driven around education and innovation.
That's awesome. Mm-hmm. And how about yourself, Richard?
Yeah, I work for Tampa General Hospital, of course. I am been there for about 10 years. And I'm very passionate about overall the technology at TGH and helping to decrease burdens as much as I can on frontline workers. It's one of my passions.
That's interesting. I think that we often forget how much the design of the room impacts the workers that are in it, right? But tell us, Richard, how would you describe kind of this hospital room of the future at TGH? Yeah,
the hospital room of the future is a really cool concept, and I had just gotten introduced to it coming into IT about 3 years ago, and it's basically taking all of the things that are manual in nature in the room and turn them into an automated process in some way, shape, or form. So instead of manual tasks of writing on the whiteboard with the stuff that a nurse has already documented, let's just document in the EMR and let it publish appropriately automatically. If there's orders and stuff like that on a door sign, digital door sign outside of a room, isolation status, let it populate and drive from the EMR versus a manual task. And integrating other things like telehealth and meal ordering from your own bed, your own room, all those different pieces coming together to create that room of the future, including some items like controlling your temperature in your room, controlling your the TV and everything else just directly from your bed. It's a great, wonderful concept.
Yeah. I mean, I think it's amazing how much we've evolved there and how much that matters to that patient experience. Amy, you just finished a presentation. Thanks for coming over after. And you were focused on your digital door sign project, which I think contributes to what you were talking about, Richard. Tell us a little overview of the project and kind of the goals of it.
Sure. So the door sign is really the entrance to the patient room of the future. And so we wanted to make sure that we were guiding anybody who's coming into the patient's room to understand what's happening with the patient in the room at a high level. Understanding if there's any isolation precautions, if the patient speaks a different language, any information that anyone entering that patient's room would need to know, from an EVS technician who's coming to clean the room and empty out the trash, to a patient transporter who's coming to pick up the patient. They might need to know that the patient speaks Spanish, right? Yeah. Anything along those lines that we call the digital front door to the room, right? So that's what that presentation was focused on, was really how can we make the team members safe before they enter a room. That's awesome. And to make sure that the anybody entering the room has as much relevant information before they walk in.
And in real time, getting the real time information for it as well. That's like the key of it. Is
right.
As it's being done. As it's being done, as it's being documented, it's publishing immediately onto that door sign.
I think it's so interesting. I remember when I first rolled out an EMR, we realized how much the paper chart impacted the workflow.
Right, yeah.
When we took it out, we're like, wait, now the paper chart's not sitting there.
Right, it's
we're
not
like,
there.
What do we need to do?
And
I think that's, but the whiteboard though wasn't updated, right? So, these digital signs change what's possible even, right? Especially from a real-time nature. So, maybe you could talk about, Richard, as you implemented, this technology, how did it impact things like safety and quality? Yeah. What are some of the data points that, from your experience with it?
Sure. Well, you can imagine nursing, you've got a lot of tasks that you're doing with your patients in real time, right? So if I'm a nurse and I have 4 or 5 patients that I need to work with, I might be in a patient's room when a result comes back and isolation sign needs to get published. And before I have an opportunity to read that, order that's come through and put up that manual magnet outside that room, that doesn't happen anymore. There's no delay. So immediately when that result comes back and they place that order that the patient's on an isolation, it comes up on that door sign, it lights it up to make sure that it's dry, it's actually showing it and making sure that patients see it. It
catches the eyes of
Yeah.
anybody walking down the hall.
Yeah.
Which is
Can't miss it.
right. You can't miss it, which sounds like it might be there might be a negative connotation to that, but there's not, right? It's it draws your eye to it, and it's a positive connotation that, hey, I need to take a precaution before I walk into this patient's room.
And even knowing like what is wrong with the patient ahead of time before you head in there, it's just really, really key, because then we're not potentially, having a nurse that's walking inside of that room that didn't know that sign needed to be put up there, right? It just happened. So we've implemented on one unit, a 40-bed unit, and we've noticed that these issues that would come up don't happen anymore. Patients are incredibly safe, and they're seeing it, and so are the staff. The staff are loving it.
It really helps with staff communication, right? So you have to go check Epic and check their chart for that information.
Well, and they probably don't go into the room and embarrassed that they didn't realize something that they should have known, right? Like, because they weren't able to check in.
Right.
How about when it comes to efficiency, and even staff satisfaction? We talked a little bit about that. Has it saved time for them? Especially the nurses who are probably the ones going in and out the most.
Yeah, I think that's a fair question. One of the things that, from my perspective, that saves them a lot of time is really just, hey, I know what I'm walking into, right? I know if this patient is having is a fall risk. I know that before I walk into the room. I don't have to stop and look at the chart or even my mobile device that may have some of that information, but it's not queued up right in front of me all the time.
It's on the
I have
pass
to go
station.
dig for it, right? So that information right before you walk in, for the physicians too, right? I know, hey, I put an NPO order on and I see it on the door sign. I know this patient shouldn't have any food, right? The dietary aide is coming to deliver food, and the NPO ordered was entered after the patient had the diet order entered, right?
Really?
So they're seeing that the patient,
So it's already there.
So this tray was made 2 hours ago. I'm bringing it up. And then the patient is not supposed to be eating. So, maybe I shouldn't give it to him. Let me go check with somebody, right? As an example.
Wow.
And what's also cool about it is when I used to work on the floor, having to find that magnet, put it up on the door, etc. I don't have to do that manual task anymore. It's just done automatically, which saves me time to put me in front of my patient longer.
It's interesting because you would think putting a magnet up, that's easy, right?
Right.
But
when you're
feels
looking
like a
for
cognitive
something, it
burden.
can be 30 seconds to a minute, maybe even a minute and a half trying to find it, then walk down the hallway. And
You're interrupted.
Yeah, that too.
Yeah, you get interrupted and then you forget to do it. Is that what you're saying? Because you were doing it?
Right.
Well, and I think it's also I don't have to worry about that. It's one less thing to think about for the nurse because it's happening automatically. Is that kind of what you experienced?
Yeah.
Absolutely.
Interesting. How about when it comes to care coordination? It sounds like you've addressed some of it, right? With the dietitian and stuff. Do you see, other care coordination or other clinical workflows, more clinical as opposed to I would describe patient experience workflows or benefits there?
Yeah, I think from a care coordination perspective, it's again, just enhancing the communication that's on the unit. There are certain icons that are up there to for one perfect example is, somebody might be in a domestic violence situation and we might not want a male caregiver or something like that in that patient's room. And so we have an icon that helps with reminding those team members. So maybe if a male dietitian's coming up, actually I need somebody else to come and see this patient or something like that. So it's informing them, it's keeping them informed in more real time, which is wonderful.
Right. I think the other thing to add is we transmit from Epic the care team onto the door sign. So it shows who the primary nurse is, the patient care tag, and the attending physician.
Nice.
So you can see all of that information as well. So if you need to go and find out, I need to talk to the nurse before entering the room, we have an icon that we can activate on the door sign that says, please see nurse before entering the room. And I know that Richard is the nurse that I need to go and talk to before I go into this patient's room. So from a care coordination perspective that has been super impactful.
Right.
Again, you don't have to stop and look at the paper or the Epic chart. You can look right there on that door sign before you walk in the room.
Yeah, that's interesting. And I know you've been working with eVideon to do these digital signs. Did they provide a bunch of templates for you to use on the signage? Did you have to create those? Because it sounds like there's all these different use cases that you've just described. How did that work with eVideon? Was it a collaborative process? Talk about that.
Yes.
The evolution of the magnets. That's what we would call
So
it, right?
it's kind of like the HR. We replicate the patient chart and then we optimize. Is that how it was? We replicate the magnets and then optimize?
So eVideon they had a standard library of icons, and then we had some specialty icons that we wanted to integrate. Some things that are, more used, what the organization is used to seeing for icons. So we gave them those pictures and they graphic designed them and created them into icons just for us. So, and we've massaged that a little bit, of course, as you go live. We are live on 4 or 5 units right now. So we've had an opportunity to work with different units and find out more specifically what we think is going to work better for these different types of scenarios. So the icons have been, I would expect that they will continue to be a constant evolution of the icons as we get better at doing this and finding out what else is meaningful. The key to me is to make sure that we're not overloading those signs with too much information and that it's really meaningful information that's at a glance I can see before I walk in that room.
And one of those directives that we've set is like, as we go into, we have a Room of the Future governance program that we review all of these changes before it's implemented and we get their feedback. And it's a multidisciplinary team from nursing to leadership, IT, EVS, transport, et cetera. All of those disciplines are super important with this. But what's really helpful is, like we've said, well, what is it that I really need to know before I walk into that room? Like, do I really need to know what diet they're on? No, probably not. I just need to know that they can't have anything to eat currently because they're waiting for a procedure. So maybe their diet is something that we just keep on the whiteboard inside, and we skinny down what we need to know before I walk in. And that's kind of the directive that we're looking at, is like, what needs to be there, just so that way it's not overwhelming to look at that door sign, which has been very helpful.
Sounds like you have good governance. But it is amazing how much it becomes a habit to see the black. I remember, this is flag days, right? The black flag was mine, right? And I'm sure they have the same with those icons. Oh, the pink icon is this one, or whatever it might be, right?
Yep.
Absolutely.
And it's standardized across the organization as well, which is, very important.
That was important to us as well, to make sure that we had a standardized across the organization, and then understanding that there will be some units that have more specific needs.
Sure.
But it's still standardized across the group, that anybody can add any of those icons no matter where they are.
That's really interesting. I'm sure that was a challenge too.
It's an evolution, right?
Yes.
We're continuing to work on it.
For sure. We talked about kind of the provider side, the nurses, the doctors, the other staff that are coming in. How about on the patient and the family side of things? What's been their kind of patient reported outcomes and experience with these digital door signs?
Yeah, I think not necessarily I think from a patient's perspective, I think they see the innovation and it's cool, right? But I think it's more impactful from a family member perspective, right? So you've got a family member that comes in, they don't notice the magnet that's on the wall in old state, but in our current state, we are now lighting it up. So when you walk up to that room, you see this big red lights around it, or flashing colors between the two different colors, and you've got the flashing note that says "See nurse" before entering, and it's drawing their attention to say, "Ooh, I need to take some action before I walk into into my family member's room." And so we're not only increasing their safety, protecting them, making sure that they're wearing the appropriate PPE before going in, but then we're also protecting the patient as well, so nothing's coming in from the outside, and then we're also protecting the caregivers who are coming in and out, So I think it's really impactful for them. From the patient's perspective, I think that they just reap all the benefits, right? They're more safe.
Right.
Everything's done in real time. The people are informed before they walk into that room of what's going on.
Yeah, and I'll add to that a little bit. I think one of the big drivers for the organization is to make sure that patient experience feels world-class, right? And this is just another part of technology can feel world-class to visitors when they're coming into the hospital.
Yes.
and that digital front door is a perfect example of it. And so if nothing else, it really lends itself to thinking that they're working with a group of folks that are committed to excellence and using technology to the best of their ability, which is what we're doing.
It's interesting you say that. I said that in the early days before EHR. I was like, if I go into a doctor and they're using a paper chart, I might question, are they not staying up on the latest other medical practices if they're not using technology in their practice? So I think that's what you're saying.
Yeah,
which
exactly.
Is exactly how I feel. And I had this actual experience. I went and visited my father-in-law. He was hospitalized. And I remember going to the door and there was nothing. It was a bit of a rural hospital, but I was like, oh man, what am I getting into, right? Sounds like it's a much better greeting at Tampa General Hospital. You know, it sounds like you guys are all about this continuous innovation and continuing to push this envelope. You know, maybe you could start, Richard, and then Amy, like, from your perspective, what do you see next for this hospital room of the future?
Good question.
Yeah, that's a great question. So we have things implemented currently for our ICU that was really like our innovation unit that really started this technology first. And what the first things that we worked on was the digital whiteboard, the digital door sign, and then we also have on there the ability to order their meals, etc. We're now doing and working on a virtual nurse program. Nice. So that way they can do safety checks and stuff like that, validate things are flowing appropriately, and all those other fun things. The next step is really looking at some of the other aspects in the room, like how can we lower the temperature, increase the temperature for the patient safety, all from the comfort of their bed. They don't have to get up because ultimately, we want to protect their safety and, call, don't fall, if you've heard that before.
Yep.
And the other thing is like the, other calls that sometimes the front desk staff get is, I just want to lower the blinds in my room. I want to take a nap or something like that, right? So letting them be able to control that, being able to control everything. And I think something else that we've talked about is ambient listening, right? Being able to say, hey, Alexa or something, call my nurse or something like that. And being able to reach the nurse from that aspect, or it sends the call light out, et cetera. And doing that because it's more natural to do it just talking, right? Especially when you have somebody that may have some deficiencies with using their hands or something of that nature. The first thing you do when you call for help is you yell out help, right? So ambient listening would be, I think, one of the next future items for sure.
Not to mention changing it to ESPN, right? Probably the most. But it would be nice, right? Because I've seen the older people get the remote and you're like, wait, I can do everything with it, but how do I do it? Well, voice is the universal interface, if you will.
Yeah.
Right.
How about you?
So I think, our mission is to be cutting edge, right? And to really look to push the initiatives and push innovation as much as we can. And we're an academic teaching hospital, so we should be on the forefront of those types of technologies and everything that we can do to automate some of those things that Richard just talked about. One of the things that we're working on piloting right now, or trialing, maybe that's not the right word, but is a room service ordering, right? Directly from the patient room through the eVideon platform as well, which integrates with our dietary system. So it just gives the patient a little bit more control over some of the things that are happening. They can decide when they want to order their, so from a patient experience perspective and pushing that envelope to get, to free up while also giving the patient additional independence while they're in the hospital. It's, you're in the hospital, it's not exactly the most pleasant time of your life unless maybe you're having a baby, right?
Yeah.
So generally speaking, there's barriers that occur with patients when they're in the hospital. You're not there for a happy time most days.
Yeah.
So
for sure. Well, it's funny just hearing you say room service sounds kind of
hotelish, right?
Yeah, hotelish and luxurious, right? Meal order sounds what?
Right.
So it's interesting how even our verbiage of how we frame it.
The vernacular makes a big difference.
Right?
Yeah. So.
Well, this is awesome. I appreciate the work you're doing. It sounds like you're doing, and I think we maybe underestimate the value of being able to put the blinds down to both the patient who's waiting and the nurse isn't coming quick enough, and the nurse is like, why am I going to put the blinds down? I'm a nurse, right? I appreciate you sharing these insights and perspectives and the success that you guys are having. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting applications. Thanks so much.
Thank you.